Public health experts are on the attack tonight, accusing the federal government of trying to weaken a proposed UN declaration designed to combat diet and lifestyle-related diseases such as heart disease, diabetes and cancer. According to a draft text obtained by Lateline, Australia is seeking to remove a paragraph which calls for a reduction in salt, sugar and fat from food. Margot O'Neill has this exclusive story.
The United Nations will host a summit later this month on the spiralling global health crisis caused by so-called lifestyle diseases such as diabetes, cancer, heart attacks and strokes, which are now responsible for 2/3 of the world's deaths, but which experts say could often be prevented with better diet and exercise. The summit is supposed to galvanise urgent global action, as happened 10 years ago for HIV/AIDS. But negotiations to finalise a declaration on what governments should do have bogged down. And public health experts say richer countries like Australia, the US and Europe have squashed efforts to include specific targets, such as reducing mortality by 25% by 2025.
Now, this document started off as quite a strong document with outcomes and targets and accountability mechanisms, and those have all gone, and now it's quite a weak, watered-down political statement.
A draft of the UN declaration, dated the 1st of September, includes one paragraph calling for countries to implement cost-effective interventions to reduce saturated and trans fats in foods, reduce salt and refined sugars in foods, including through discouraging the production and marketing of unhealthy foods. But according to the draft, Australia wants that paragraph deleted, as do the United States and Canada. And that, say public health experts, is because of powerful corporate lobbying.
I think this is a major concern that Australia, along with some of the other wealthy countries like the US and the EU, are seeking to weaken the wording, or in this case, pull out a whole paragraph which refers to the implementation of cost-effective policies to improve the food supply.
The hardest hit are developing countries where lifestyle diseases are responsible for most premature deaths before 60.
The food industry clearly wants to continue to grow its markets for high-fat, high-sugar foods in developing countries. And this is a little bit in parallel with the tobacco industry. Once the clamps come on in the wealthy countries, it shifts to the poorer countries to promote and sell its products.
Australia's international position appears to be at odds with its own national agenda.
We've actually spoken to the Federal Department of Foreign Affairs, and what we're concerned about is, on the one hand, the government is there establishing the National Preventive Health Agency, looking to deal with obesity, putting a whole lot of effort into it through the Department of Health. On the other hand, through international treaties, it's being undermined. It just seems that one hand of government's got no idea about what the other hand of government's doing.
A spokesman for the Health Minister, Nicola Roxon, told Lateline tonight that the government couldn't comment on the negotiations, but that it was a world leader in combating smoking and that it wanted the strongest possible outcome from the UN summit. A spokesman for the Australian Food and Grocery Council said industry is working with government to reduce salt, sugar and fat in processed food. Margot O'Neill, Lateline.